Hello everybody and welcome to this week's video where we're going to look at whether or not bone fragments or chips in the joint can reattach. My name is Simon Hennessy here at Angus Equine Hospital. So if bone fragments or chips develop purely because of trauma, then they're less likely to reattach and they're probably merit removal. However, if bone fragments are developing due to osteochondrosis, then as we said in our previous video, this is a focal weakening of the bone. And if we can find that focal weakening of the bone before the fragments develop, then there is potential for reversal of the disorder and potentially reattachment of bone before fragmentation occurs. For this to happen, we have to identify our osteochondrosis usually in foals well before the yearling stage. And these foals will often present to us with swollen joints or maybe intermittent lameness. And that is the first clue that we have that osteochondrosis is occurring. These foals are often several months old. The vast majority of the foals that we will deal with have osteochondrosis of the stifle and will often present between 6 and 9 months of age. And most of these foals will be going through rapid growth phases when we identify that osteochondrosis is present. So if we manage to identify some of these potential fragments that are developing in our osteochondrosis lesions, then we can aim to reattach them either surgically by placing absorbable pins in appropriately selected cases or through conservative management. Conservative management usually involves box rest to limit loading or excessive exercise of the joint, which is likely to knock off the weakened bone that has developed due to osteochondrosis, anti-inflammatory therapy to help reduce the inflammation in the joints that has led to the joint swelling, reduced intake of nutrition and energy, especially because a lot of these foals, when they present, will be going through rapid growth phases and the body is struggling to keep up with this rapid growth rate. And supplementation with trace elements and minerals to ensure that your foal is getting adequate amounts of calcium, phosphorus, copper and zinc, which are all very important nutrients in the endochondral ossification or bone formation phase. While neither surgery nor conservative management are guaranteed to give you a full resolution of OCD, in many cases they can, but at the very least they should reduce the joint inflammation and at least reduce the size of the fragment you can expect to develop in that joint. These management changes help to reduce the effects of excessive loading and nutrition, which are very highly linked to the formation and the development of osteochondrosis in these foals. The use of breeding programs alone to prevent osteochondrosis is almost impossible because there are so many genes that are directly associated with the development of osteochondrosis, and many of these genes are also directly associated with athletic potential and general athletic traits that you want to have in your horse. So trying to breed osteochondrosis out alone has met with poor or limited success. And that's it. Join us next time when we'll look at whether or not all fragments need to be removed. Talk to you then.